good evening, and welcome to adminchat. And this evening, I'm absolutely delighted to be joined by my very dear friend and international trainer and storyteller, Kemetia Foley. Kem, how are you? I haven't seen you, I don't believe, since Atlanta.
No, we haven't seen each other since Atlanta. It's
Such a long
crazy. That's a whole
time ago.
year.
I know,
A
that's
whole year.
mad. It feels very strange having seen each other in so many different places over a period of time to suddenly be cut off from that.
It does. It's really frustrating too, right? Just like, darn it.
Yes, for sure. So what have you been up to for the last year?
Oh my gosh. Well, we've kind of gotten settled into our new home in Maine. Doing a lot of work here in the region with storytellers. So there's a storytelling troupe here. So where I live is right at the border between Maine and New Hampshire. So we're right at the border. And so True Tales Live is a public access television sponsored storytelling group. And before the pandemic, they would do recorded television shows in Portsmouth, New Hampshire. Now we're doing it on Zoom. So it's really fun. It's different. I'm really happy to get tied into that community. I'm doing some contract work too, like keeping myself busy and paid and paying bills and stuff.
Well, that's kind of handy. I know your background is very much from that storytelling background, isn't it?
Very much. Yeah. I'm not even the best storyteller in my family. My brother Bill is by far the best storyteller.
Yep. If anybody has missed it, you have an amazing session on storytelling.
Oh, that's right. We did for this year for live.
We did.
Online. We did.
It was amazing. So you can go check that out if you're interested in seeing Kemetia's session on storytelling and how businesses are using that.
Yeah.
But you've done a recent article for us, haven't you? A very personal article about mental health challenges. Let's go back a second. I know that we're seeing a lot out there at the moment. I mean, my timeline is certainly full of people who are losing their jobs or who are feeling uncomfortable or who are working from home. What are you seeing where you are?
A lot of the same. So the big companies are, and this is just perception because I haven't had a chance to look at data, but are letting go of people who are near or close to retirement age. So if they can offload those folks are getting let go or bought out. What we find here is that as the companies cut back, that's really the first layer. And this happened in 2008 too. The first layer to go is support staff. And the other thing that I see, although I'm not sure how they're phrasing it, is that employees of all job titles, right? If they're not able to make that shift, that change, and pick up the new way of work quickly, they're also being jettisoned because companies don't have time for those people to catch up. They just have to be able to, for whatever way that they need to do it, and they need to do it quickly. And I think even for me, right, it's hard because there's so much stuff up here. To learn something else new and cram it in and try to do it quickly and do it right is so hard.
Yeah, really, really hard. I mean, I think that the assistants need to be kind of aware that after they had got rid of them, they suddenly realized that they needed them back. And I think to a certain extent, there will be that happen once we're out the other end of this.
Absolutely. Absolutely. The folks who are holding down the fort right now are people who have been able to make that change quickly and have become incredibly valuable to their companies. And I see a lot of that in postings, the temporary to permanent hire companies here in the States. They need people who are willing to recognize that companies are struggling with cash flow, but also want to continue working And so you see a lot of that here.
Yeah, we're seeing so many assistants who either are absolutely overwhelmed with work, just like last time, where they got given everything to do because the middle management had gone, or we're seeing assistants sitting there like deer in the headlights going, what am I meant to be doing? Nobody's telling me what I'm meant to be doing. And I'm really scared that they are going to get rid of me because they don't understand what I do.
Right, that's a perfectly valid point, and you wonder, and I think also you've probably seen this. There's a large shift in our colleagues who have gone virtual, like they've just left working they've gone independent contractor. They've opened their own business because they can't they can manage their own work and their own workload and their own marketing and their own and selling their own skills. If they do that, but companies are going to realize I need those people.
Yep. I think it's interesting though, Kem, and I know you would agree with me here, because there's a lot of talk about virtual assistants and virtual assistants being people who are working remotely. And that isn't what a virtual assistant is. That's remote working. That's not being a virtual assistant. Being a virtual assistant is what you're talking about, which is
Correct.
looking after your own clients and billing them for yourself by invoice and having to do your own marketing and having to do your own selling. That isn't necessarily the core skill set of an assistant.
No, it isn't. And you see that some of the difference between that remote work and that virtual assistant, and that remote work piece being the security and integrity of company systems when they move outside their own server set or connect outside, having employees have to use their own equipment.
Yeah.
You know, and I think that they're not used to seeing us knowing how all that works, right? They're just like, oh, how do you know all this?
Yes. Yes.
Because I've been setting up people for you for years, right? You onboard people, you get them on board, you get them going, you know all the equipment challenges, you know the IT people really well, or the IT company that's contracted with you. So that go between role is super valuable.
Yeah, absolutely. I couldn't agree more. So let's go back to your article then that's been published about mental health. And it was a very, very personal article. It was a very moving article, actually. I wondered whether you were concerned about being so honest and straightforward in that article.
Well, I think anybody who writes publicly has to be ready for the pushback. With some of the stigmas surrounding public mental health and it kind of, pull yourself up by the bootstraps, poo poo sort of thing, there is a hesitancy for people to share where they are at. Especially with pandemic, right? Because everybody is in all of a sudden in a very similar boat. But yeah, I was nervous. But at the other hand, I felt like, and we've talked about Susie before, right? Susie Barron-Stubley. It's so important to speak what is actually going on out there. It far outweighs pushback. I mean, that doesn't mean it's not scary, but it's we're always supposed to just take all the punches and keep rolling as support staff, like we constantly take more, and I just felt like this was really important to share.
Yes. Let me just clarify for anybody who doesn't know who Susie Barron-Stubley was. Susie Barron-Stubley, we lost 5 years ago. Can you believe it's 5 years ago? That's just so scary. But Susie was, in her time, probably the top trainer for assistants in the world, and she was really a go-getter. But unfortunately, in the end, her demons got her, and she took her own life. So we all say, all of us who loved her and who worked with her, how much we wished she had talked to us at the time about where she was and about, the voices in her head that were telling her that she wasn't good enough because she was the most beautiful and talented young woman.
Absolutely. So I only had the option of meeting her that one time at live, and I was totally in awe.
Yeah. She looked like Jessica Rabbit.
Yes, she did. All the way down to the green dress and red hair.
Yes. Stunning woman, and the most amazing trainer. But you said that the majority of the people that we both work with, of course, are administrative professionals. Why do you think the pandemic affects them more than other people in the office?
So it really struck me right off the bat. We are master contingency planners. Like that is our mojo. That is our kind of our what we're known for, like what we do for plan A, plan B, plan C. And in this particular time, that doesn't work. I mean, you can't plan. You cannot. The thing that is our very core strength is something that is we are unable to capitalize on and utilize, even though. So, for example, holiday parties. This is a great example of that. Everybody plans for holiday parties at the end of the year. Well, certainly people could say, oh, well, I'll go to plan A, which is I will plan something for my team on Teams or some sort of live stream thing, or we'll hire a band to play for them. But you cannot even, that it's like shifting sand under your feet all the time. And so to have that core competency through no fault of our own be eliminated or decimated is really hard for us as a field. Like, how do we prove our value if we can't even contingency plan when that's our strongest suit?
I think you're very much the chaos tamers, aren't you? The assistants. I mean, you're used to controlling the uncontrollable and finding a way to do it. But this really is totally uncontrollable. I keep having to remind assistants that are really past it that actually you are trying to operate from home in a pandemic. It's not just working from home.
Right. It's not even some of the normal tools that we would have on a workday basis where we would catch up with one of our colleagues. We would step away from our desk and go grab a coffee just to vent, right? And now everything is video. It isn't the same. We don't know necessarily how to explain that, why it's not the same, but it's not the same. That camaraderie is not quite as supportive as we need it to be.
It's very strange, isn't it, Kemetia? I mean, last week I trained my new sales team and I had people in a room for the first time in 8 months. I got up and presented to them. I was so emotional. So emotional.
I'm sure I would have cried. I'm sure I would have cried.
Because of course we were social distancing, so they were sitting in different places in the room, and we had a photo at the end of the week where we weren't social distance, but here, if you've been together for 7 days, you're equivalent to being in a bubble. So they're kind of, well, if you're all right by now, then you're probably going to be all right. But that first morning, getting up and actually training people face to face, it felt so overwhelming in a wonderful way, but very
right.
What do you think it's going to be when we go back?
That's a great question. I think it's going to be incredibly tentative. It's going to be hard to be confident in your choices and your decision making because your trust has been eroded, right? Your routine's been eroded. Those things that it's just like any other, I mentioned, I think in the article, it's like a fight or flight sort of reaction. Like, it's like Charlie Brown getting the football pulled away every time. So when you go back to the office or you go back to whatever the situation comes to be, it's going to take time to trust that routine, whatever it evolves into, is going to be somewhat more stable than what we're going through now.
Yes, for sure. And that whole fight and flight thing, you know, we didn't used to feel fight or flight just getting a bus or, you know, walking down the street and somebody coughs at you or whatever it happens to be. Normal. It's going to take a little while, I think, to untangle ourselves from that.
Right, because when you go back, if, for example, you're trusting that people are doing healthy behaviors, but you have no way of knowing that. You're not going to go to your boss's house and watch through the window and see if they have 15 friends over or 20 friends over. You're not going to know.
Mm-hmm.
And they're certainly not, because of the pushback, they're certainly not going to tell you, by the way, I'm having 20 people over my house this weekend, right? Because they know that's not socially acceptable, and it's in some places it's illegal, right? For right now. So that ability to build trust with your team is going to be, it's going to take the leadership to say, okay, here are the rules, and here's what we're going to do about these situations, so that we all can start building that trust back.
You know, this whole lockdown thing has been really hard for people, just being away from friends and family and co-workers and, you know, not having the social interaction. You had some really great tips for that. Could you share them with us?
Well, I think the biggest thing really is don't go it alone, right? Don't try to do this. Don't. So even for me, and I talk about stuff all the time, you feel like people get tired of hearing you, like you're complaining too much, you know, like it comes across as a complaint or a whiny sort of thing. But that's not the case. So find somebody that you really trust, or if you're not sure, you can find somebody you really have that trust with. Go to a medical professional and have a conversation about how you're feeling, because feelings aren't facts, but they feel like they are. You know, so don't go it alone. Talk to a professional, talk to a trusted best friend, and just be honest. Like I've said this on, I don't know how many videos that I've done in the last year. I can't cry. It is absolutely maddening, because we all know that when you cry, it releases a lot of endorphins and kind of resets your system. And I can't cry, and it's just so infuriating, you know. But I talk about it a lot because I want people to understand that if maybe they can't cry, maybe they can't cry either. So talking about it definitely makes it less isolating, I guess.
Well, you know, I've suffered from my own mental health problems in the past, and my doctor said to me when I got really sick, which was back in 2010, you've got to stop putting this stuff into boxes, because sooner or later the boxes open and then you're going to have to deal with it then, probably all in one go. And the way to do that is to talk to people about it as you go along. And don't care if you think you're boring people to death. If people love you, they want to help.
Right. I actually said to this contract supervisor that I'm working with, I said, I need you to, like, this was not out in front of the rest of the staff, but we were having a very serious conversation. And I said, at some point, I may just start crying for no reason, because I haven't been able to cry, and it's going to come out sideways somewhere. I know it, right? I know it's going to happen. And I said, I just don't want you to panic or think that I've lost my marbles. I will step outside to my car or the restroom. But I just wanted to give you the heads up, because I feel like I owe you an explanation when this, because I have no idea when it's going to hit, but I know it's going to hit sometime when I least expect it.
Yes. It just gets overwhelming, doesn't it? And then something can be really small, and it can mean that you're very emotional about things. I mean, the other thing is, of course, these people right now who are in lockdown, who are trying to juggle working and looking after their children and looking after their husbands and educating their children from home and everything else. And there are various offices I've heard behaving terribly, appallingly, where, you know, bosses are saying, we need you on this call at 2 o'clock, and they're saying, well, I will be, but it depends somewhat how my 3-year-old is behaving. And they're saying, well, this is your job, you just need to be there. How do you deal with that?
Yeah, so it requires like super communication, right? Like this super work on communication, but it also requires can you work with your colleagues? Like if you still have a team, like if you still have an admin team that you're working with, can you guys communicate about where your situation is at home and try to work out a plan ahead of time to say, look, can you take notes on this call for me? Because I have to do this at 2 o'clock with Teddy's teacher. I don't know. I think, you know, kind of that take a step back and realize that nobody knows how this is supposed to work.
No.
Even our bosses, right? Just because they're bosses or vice presidents or directors, they're just so used to doing what they've always done that
Being
they don't
told to do.
being told to do, exactly. So they just expect everybody else to go along with that. And the risk, of course, is that you can, in fact, alienate your most valuable employees, whether they're admin staff or not, doesn't matter. They're just going to say, this isn't worth it because I have to take care of my family. And you find it particularly in organizations that say, we honor, you know, we want our employees to put family first, but then not so much, right?
Yes.
So
I just actually bought a domain name, where do we go from here? Because so many people keep saying to me, where do we go from here? And so many assistants are writing to me saying, I've had it. I'm going part-time, or I'm going to change career, or I'm leaving this company, because actually they've suddenly realized how important it is to have that peace of mind and to have a happy family. You know, here in Spain, where I've just moved to, the pricing of all the properties is going up sky high because of the number of people moving out of the cities and moving here so they can be by the sea, so they can have the nature, so they can have the fresh air. And we're just making it all work in a very, very different way, I think.
yes, I mean, it really is a work revolution, right? It's an evolution that nobody saw coming. Everybody saw the artificial intelligence issue, but maybe they didn't see this piece of it for sure, right?
Yeah.
I don't know. It's a very fascinating time, and we have the same issue here in Maine. We have all these people moving up from New York and Connecticut who had, some of them had second houses here already. And they're just like, well, I'm just going to move to this house and stay here permanently. And there's a little bit of bristling amongst the locals. They're like, no, we don't want you here.
No. Well, this is what's happening here also, because where we are here in Kemetia, I think we've had 9 cases the whole of COVID. 9. And
Wow.
so when people say they're coming in from London or from Madrid for the weekend, they're like, no, no. You know, we're keeping this really under control. Thank you very much. We don't want people coming in from the outside right now.
Right. Exactly. Yeah. Yeah. But I feel like, we have an opportunity here as two people who have battled these challenges, right? We've kind of been through it, and we can look back and get perspective. And people who have been through some challenges, it's not a my challenges are tougher than yours kind of thing, right? It shouldn't be that way. It's not a competition. It's more of how can we help each other get perspective? How do we help each other? That's the point of talking to somebody else is get somebody else's point of view on it, because otherwise it just seems like the problem is so huge when in fact it may just be because you're, like you said, tired or hungry or incredibly lonely or overwhelmed or whatever.
Yes, well, we have 2 members of staff who are at home, and for the longest time weren't allowed to go out at all. And, you know, that was very, very hard on them. For me, I just feel that it's important, if people are feeling overwhelmed, that they understand that that's okay. I mean, 1 in 4 people is seen as being what is classed as the worried well, you know, so which
Hey,
yes,
right
totally.
there with you.
Yes, totally. Which means that there are some times where I'm really not okay. But then I know, as you said, I have to check. Did I get enough sleep? Did I eat properly? Did I have too much to drink? What is it that I have done that has changed my biology or that isn't keeping me aligned? And these days, I self-medicate by saying, I'm going to bed at 9 o'clock tonight. Or, you know, I am only going to drink at the weekends. Or I'm going to go for a long walk so that I get some exercise, because, of course, as my son would say, that releases the endorphins. Or, you know, but there are things that you can do to self-medicate without necessarily having to go on medication.
Right. I think one of the best suggestions I ever received was to plan something you can look forward to. So, like 99% of people are completely zoomed out, right? If they never see another video or have to do another video conference call again, they'd be perfectly fine. But maybe it's as simple as 3 friends that you haven't talked to, or and just schedule a time away from everybody, just so it's just the 3 of you cackling online, and it's not a whole conference call, and you could be in your pajamas and you don't have to put makeup on, and if your kid comes running in with a snotty nose, it's okay. You know, it's a different purpose, right? You're refilling your tank with the people who love you, that you love, and you're doing the best that you can to let them know that.
Yeah. Or as simple as a cup of hot chocolate and a beautiful piece of music. It is just finding, isn't it, that even just 10 minutes a day, I find here, I mean, I'm very lucky because it's obviously sunny all year round, but for me, as long as I get my 10 minutes in the morning where I'm sitting on my balcony with a cup of coffee, I'm good. I
Yeah,
just need that 10 minutes headspace a day. I
10
know
minutes
you're
of
the same, aren't
headspace. Yes, very much so. Every morning, um, and and here it gets dark so early now. Like it's 4 o'clock in the afternoon. It's dark.
you? Yeah.
And very long, dark days. And God forbid it rains. It's dark all day.
Yes.
So um, you have to really focus on those things that are like, okay, what's good about today? I joke about that on some of my videos sometimes. What's good about today? Today it's good because I've got my Annelle Martin mug from
You're
her.
caffeinating.
Yes, caffeinating up, from her little collection, and I've got coffee, and I've got you, and um, you know,
You're
today.
very into that, aren't you, Kem? And I love it. You make your gratitude lists. And I love your other article, The Attitude of Gratitude, because it was a revelation to me when I read that. It's a relatively old article now that you wrote for us, but really it's one of our most viewed, and it's wonderful.
It's the silly little things that it goes back to what I said earlier. It's really perspective. Like I am no saint. I get grumpy and grouchy and beep, like just like the rest of the folks. And when I feel that, like kind of, we call it our house, we call clucking. Okay, so we call it clucking, like back, and just bitch, gripe, gripe, gripe. And when I feel that feeling coming on, I know exactly that that's what I need to do to change perspective. It's imperative.
And so we're coming up to Thanksgiving as we're recording this, although I'm not quite sure when Matt's going to broadcast it yet. And I will put the article about the attitude of gratitude, and I will also put the article on the mental health challenges into the discussion box beneath this video so that people can access them really easily. But what are you particularly thankful for, even in the midst of all this chaos at the moment, Kem?
Quite honestly, that I haven't cracked.
Yeah.
I mean, I'm one of those people that feels everything I can't help it. I've always wanted to be one of those people who just seems to let everything roll off their shoulders and like they don't give a rat's. And that's just not how I'm wired. And as frustrating as it is, it just is who I am made to be. And so, um, between move, a change, changing of positions, um, change of culture, because it's a huge change of culture here from Maine to DC. It's completely different, and our elections and the stress of that, because I care, right? Even though I know I can't control most of that, I still care about the outcome. And so not cracking and letting that be the thing that drags me into a deep depression. Like I could be the worried well.
Yes.
And not be in a full funk, flame out depression where I can't get up off the couch and I don't care anymore and I don't bathe. All of those things that happen when people go into serious depressive episodes.
Yep. You have a lot of small things that keep you going as well, though, don't you? Because I see on your lists, and I heard her mewing earlier, Fiona is.
Yes, Fiona just came back from her veterinary visit for her annual visit. She's 6 years old now, and she has to have some dental work done.
Okay.
I didn't even know that was a thing, but apparently it is. So, but she's good. So you're talking about the one thing in the morning that gets you going. And last night I was thinking about this. Was that last night? Or is that so early this morning? I can't remember, right? This is the whole time blur for pandemic. We can't tell one day from the next. And I was sitting in front of our wood stove on a rocking chair, and she hopped up in front of me on my lap, and we just sat there in the quiet.
Yes.
And that moment was like,
Yes. Yes. Animals
yeah,
have a great propensity to do that for you.
right?
Yeah.
Yeah. So I really miss you.
Yes, I miss you too. I miss you a lot.
We
But
have some serious carrying on to do when we catch up face to face.
oh, you had better believe it, lady. You had better believe it. And so, talking about what happens next, what's next for you? I know you've got a new website out, this Coffee and Courage. Tell us a bit about that, because you stopped Office Renegade, which was your old handle, and you've moved to Coffee and Courage. What's it all about?
Well, really brought on, obviously, by pandemic. Somebody asked me, what are the two things that are getting you through the day right now? And I said, coffee and courage. And so Coffee and Courage was born. And there are really three focuses on that site: health, humor, and happiness. And it's like, what are the three things that I'm focusing on that kind of support that coffee and courage, right? So humor, like funny stuff, funny comedians, like people put up, go check out this comedian on Netflix or whatever. Health, which I just posted a blog about today, about how, it's been very hard for me not to eat my ice cream all the way through this last couple of weeks. And happiness, those things that bring us joy or bring us happiness, whether it's a symphony or a cat on our lap or walking on the beach with the people that we love. So I wanted to turn the focus on more on what are the things that are so that my job, my work, is not my sole focus of purpose, which it most certainly had become. And so I wanted to kind of change that approach to reflect that,
I'm sure that the audience will absolutely love it if they go and take a look. I'm going to put the links to that and to your Twitter channel, your Twitter handle.
Coffee with Kem.
Coffee with Kem, exactly. Just underneath the video as well, so that they're able to contact you.
Yeah, I think most people kind of know my story about coffee. So.
Oh yes, you better tell it for those that haven't, though.
Well, I'm just a coffee junkie. That's all there is to it. It was one of my highlights of my career to take Lucy to her first Dunkin' Donuts.
It was a very good donut. Very good donut. And I don't do donuts, but it was very, very lovely.
Yes, that was quite an adventure. That was a fun weekend.
So listen, I'm going to round off the interview, but I'd like you to leave them with some words for those people who are feeling utterly overwhelmed at the moment. What do you want to say?
Well, my first reaction is keep the faith. If you're somebody who is a person of faith, that's certainly really important. If you're not a person of faith, I would say just today, just deal with today. Just what do you got to do just for today? What is the absolute important thing that you must get done today? And then check it off. Like recognize the fact that even when you're feeling like you're not getting anything done, you are in fact getting things done. Be kind to yourself. Make sure you tell the people around you that you love them and what they mean to you, because remorse and regret are poisons. So that doesn't mean just for today, just focus today. Sometimes just focus on the hour, right? Just like what am I going to do in the next hour? I'm going to finish this, or I'm going to go for a walk. Just that 1 hour. What are you going to do? When you break it down like that, it's a lot more manageable.
Yeah, they say, how do you eat an elephant? One bite at a time, right?
Right, exactly.
Yes.
Exactly. So I have to ask one quick question before we wrap.
Oh, yes.
Because we're watching The Crown here, season 4 in the United States.
Oh, yes.
What is your take on the portrayal of Diana? Now, I haven't watched the whole season, but do you think it's fair, or do you think it's kind of a little bit much?
I can't really comment because I haven't seen it yet, and I'm really looking forward to seeing it. But what is fun and what is really interesting is that Patrick Jeffson, who was Diana's personal aide, is actually somebody that I have speaking for us on our speaking bureau. And I had a wonderful conversation with him last week, because I'm interviewing him tomorrow, in fact, for Von Lanthen's latest conference. Although watch this space, because he is coming to our audience very soon. But he said, oh my dear, they've cast somebody very handsome to play me. He said, and he was laughing so much. But he said, it's very funny to see yourself portrayed in a drama like that. So I'm looking forward to seeing it, because I just love The Crown anyway. But because we've just started this new office and we've got new staff, and I'm in the office till 9 o'clock at night, we haven't managed to do it. So I'm hoping to catch up at the weekend. But I'm also looking forward to seeing how devilishly handsome they have made Patrick Jeffson.
Yes, well, now I'll definitely be on the lookout for that character.
Yes,
I will most certainly. Yeah, we haven't gotten that far in the season yet, but we're trying to stretch it out to try to make it last.
Yes, indeed. Yes, indeed.
Yeah. So wonderful to see you.
No, go on.
So wonderful to see you.
It's so wonderful to see you too. And listen, anybody listening, if this has resonated with you, or you are feeling like you are past it and you need to reach out to somebody and you're not quite sure who, please do, either to Kemetia or myself. If you don't feel there's anybody else that you can reach out to, we would be delighted to hear from you and just to listen if that's what you need.
Absolutely. Absolutely. Yeah.
Absolutely. Kem, thank you so much, both for your article and for this really frank conversation. It's been great, and I'm sure that there are a lot of people out there who will have found this hugely useful. So thank you for your honesty.
No, I appreciate it. It seems to be what I'm meant to do.
Yeah, and when it's the thing you're meant to do, it can't go wrong, right?
That's what I've heard.